After 8.5 years as an emergency room nurse, I have worked my last full-time shift. I'll still be in the ER on a per diem basis, but I am taking a huge step back from the bedside. And honestly, we kind of need to talk about why. I'm sure you've heard that there's a nursing shortage going around, but that's not true. There are millions of nurses, more nurses than now than there were before the pandemic. However, there is a shortage of nurses willing to put up with the crap that is dealt to them when they work at the bedside. Bedside nurses are held to impossible standards, and those standards really need to change, or this bedside nurse shortage will get much worse. There are so many metrics that nurses need to meet during the day, and hospital systems and the healthcare system as a whole keep adding more. More responsibility to the nurses, more metrics they need to meet, more things they need to do in a day. But we're having to do these more things with more patients at one time and sicker and more complex patients. And also patients who are angrier than I've ever seen patients before. The pandemic, COVID did a number on the US healthcare system, but I think it also did a number on the general population and their audacity. Ever since the pandemic 5 years ago, people have just gotten angrier and more belligerent and honestly, quicker to the draw to get violent with nurses. Before the pandemic, it was like a once in a while thing that somebody would get really upset and get in my face and try to square up with me. But since the pandemic, it is a routine thing. Yep, here we go again. And that's a freaking problem. And here's the thing. We still have to take care of these violent, ignorant, abusive individuals. We can't just kick them out and say, good luck, bestie, don't be an ass. We still have to take care of them. We also have to meet the 9 billion metrics we have to measure every day. Hourly rounding, assessments on our patients, getting our meds in within the right time period, even though pharmacy is taking 27 years to actually send us the medication we need. Getting patients who we are concerned are having the stroke over to the CAT scan fast enough, despite the fact that the doctor's in the triage room doing their own assessment saying, wait, just let me finish. Wait, just let me finish. No, we need to go to the CAT scan. Despite the fact that any person with chest pain who walks into the emergency department should be getting an EKG within the first 10 minutes of their arrival, except you're already triaging somebody else who also has chest pain, and there's nobody else who can help you because there's not enough bedside nurses. You're supposed to be hourly rounding on every single patient you have. Oh, is one of your patients super critical and needing your undivided attention for a little bit? Well, you still better be doing your hourly rounding on everybody else. How about your little old lady who had a mini stroke and is actually totally back to baseline and doing super well right now? You still need to be doing your every 15 or 30 minute neuro checks. Even though your other patient is currently being intubated, you better make sure those are charted at the right time. Oh, your patient's going straight from the ER to the OR to get their appendix out? Well, great. Make sure you do the pre-op checklist and you bathe them with those CHG wipes to wash them all down. Make sure you get that done before the OR comes to take the patient. Oh, and the glide scope that the doctors use to intubate patients, something out of the nurse's scope of practice. Yeah, that thing. Make sure you, the nurse, have it stocked just the way the doctors like it. You only have one doctor who can verify that EKGs do not show massive heart attacks. Well, you need to make sure that EKG you did back in triage, that you hand it directly to the doctor. Are they seeing 27 other patients? Sure, but you need to go hunt them down. Don't worry about the line that's forming out in triage of people you need to see. You need to make sure you hand it to them, and the physician's the only one who can look at it. And above all, you need to make sure your patients are happy and they feel like they were heard. Is the doctor really busy with multiple critical patients and taking a long time to give results to a patient with a minor twisted ankle? Okay, make them feel good about it. Oh, and nurses cannot give results. That is out of our scope of practice. We can explain results after they're given, but we cannot actually give results. So every time you ask and we say, I don't know, we know exactly. We just legally can't tell you. So while the patient in curtain 3 is furious that Dr. Jones hasn't come back in to let them know whether or not she has COVID or the flu, you, as the nurse, get screamed at about it. And then, because that person complained and it brought down your patient satisfaction scores, you, as the nurse, will not get your full merit raise for the year because you didn't meet all of the unit goals. You told your doctor that this stroke-like patient literally almost fell in the waiting room and that we probably shouldn't get them up right now, and they choose to stand them up, and then they fall. Guess what? Nursing gets in trouble for that fall because you let a patient fall, despite the fact that you told this doctor, don't stand that patient up, they're going to fall. And again, you won't get your whole merit raise because now we haven't reached our no falls goal for the year. And when the floor gets full, because, the floor nurses only have a certain number of patients they can take in a certain number of rooms, which I will say is too many patients anyway. They should be taking about 2/3 of what they do take. But all the beds upstairs are full. Well, guess what? Now we're going to keep the admitted patients in the emergency department, in the emergency room beds. So yeah, now you're going to do all the inpatient stuff and all their charting, plus ER stuff on your ER patients, because you can't just have one section of just admissions or one section of just ER. It's going to be a mix of the two. So make sure you do all their checklists and do all their orders correctly. Oh, and that won't stop the ambulances from coming in or patients to be walking in the front door. So now guess what? You're the pivot nurse sitting out front, and now you have 35 patients who are technically under your care because you're sitting out in the waiting room watching them. And, ooh, we got a bed open. Let's get this quick one in and out. Well, actually, it's a 3-fer, so there's 3 patients and they're all related. We'll just put them in one room. Well, guess what? The doc who went in is a black clown and decides to order all of the tests on every single one of them. So now you don't have 5 patients in your section. You have 7 because we put all of these patients into one room and they're all full workups. Also, your patients are hungry and all you have are sad turkey sandwiches and maybe some ginger ale if you're lucky. However, food services will only give you enough food for maybe half a day. Despite the fact that you were holding more patients, they won't give you more food to feed your patients. And make sure you check the glucometers and make sure they have their controls up to date so that when somebody does come in with, stroke-like symptoms, we can get a sugar really fast. Oh, but Ellen, don't you have techs who can do that kind of thing? Sometimes, sure. But the tech or PCA doesn't get paid near enough, and I don't have them all the time, and I'm not going to expect them to do every single thing because they have a million things to do on their own. Oh, and nurses, you can't have your water at the nurse's station. You can't have your caffeine at the nurse's station. You can't have any snacks at the nurse's station. The docs, they can go hide in their computer room or just sit at their desk and have their whole spread of takeout. Nobody's coming around the corner to yell at them. But fear not, my managers will make sure to know, hey, can't have food at the table. We really want you to go back to the break room. Okay, you watching my patients? I know you're not. I've dealt with JACO or Drink Commission coming a fair few times and hid all my drinks in drawers, but don't worry, the docs still had theirs. Nurses are expected to not eat, not drink, not sit, because Lord knows as soon as you sit down, a family member will come around the corner and be like, what are you doing? My mom needs help. And you don't even actually know who their mom is. You don't recognize them because it's not your patient. You know nothing about nothing when it comes to that person. And make sure you chart at the correct time all of your assessments and keep up on your vital signs. And did you do your hourly rounding? That's right. You need to lay your eyeballs on every single patient you have every hour, no matter what's happening with all of your other patients. And that nice stroke alert that you had, guess what? Make sure you're doing your neuro checks every 30 minutes, and it needs every 30 minutes on the 30 minutes. You can't be a minute late with that. And the list goes on, and the nurses have to be the one to stand there and take the verbal abuse and get yelled at by management for not meeting all the metrics and get scolded by the CNO because we're not creating a culture that makes people want to stay, and we all better be praying for raises. It is too much. I have to take a step back from my mental health because this job sure as shit ain't worth it. The healthcare system needs to figure itself out and realize that nurses are going to keep walking away from bedside if you keep demanding more and more with less and less. So, I'm going to focus elsewhere.